Hi there. Welcome to Digital Health On Air. My name is Aditya, and I'm joined today by an old friend and colleague, Adam Cherrington, who's the VP of Digital Health and Patient Voice at KLAS Research. KLAS, I think, needs no introduction to the world of healthcare, but it's one of the leading research firms in digital health. We're excited to have Adam join us today on Digital Health On Air to give us insights on what patients want from healthcare and what to expect from healthcare in 2025. Adam, welcome to the show.
Hey, thank you. Great to be with you, Aditya.
And so, Adam, I love to always start these with a little bit of like what your background, how you got into healthcare, how you got into healthcare research, like understanding the IT ecosystem. Maybe a couple words about to get us kicked off. Everyone, I think, knows KLAS well, but I'd love for folks to know about Adam a little bit more, kind of your journey that got us here.
Yeah, thank you. Been with KLAS Research almost 13 years and really just had a passion for how can we improve healthcare. And, I did a few things in healthcare prior to KLAS, worked at a clearinghouse, and always had interest in research and marketing, and gravitated within KLAS towards patient engagement and the voice of the patient. It's been just a fun journey. I'm sure we're going to talk about, but I love what we do. It's really fun to be on the sidelines. I get to talk to provider executives, and the next minute I'm talking to vendor partners and hopefully helping them align. Often they want the same thing, and if we can improve healthcare by helping those things align, then
that's a win for everyone.
It's a win for everybody.
Healthcare is one of those things where I like to talk about is it's not a zero-sum game, right? Like multiple boats can rise if we do things well. And I think that's pretty, what you're saying about, you're talking providers one day, healthcare vendor, like IT vendors the next day, which is really apropos because we just came off of health. You were there. And like, what's your 1 minute take on what you got out? I mean, you can take 2 minutes if you need to, but what's your 1 minute take on what you saw at health this year? What was buzzing or what was maybe busted now?
Yeah. So to no surprise, AI was everywhere. Lots of discussion there. Personally, I was surprised how wide the topics were. Lots of startups, lots of wellness companies. And that's more of a comment on the meeting itself. And perhaps that's an element of what is needed in healthcare: more collaboration across different stakeholders. Certainly, no shortage of new ideas were out there. But I'll take a moment and just share broadly what we're hearing related to that. So on a macro level, we've released a couple of reports with Bain and Company, another one with Chime and Most Wired. And there's some themes that have bubbled up. Certainly cybersecurity is number one.
Sure. Yeah. I remember that in the Bain report that you guys did being like a clear area of CIOs like headspace.
Yeah, absolutely. Still top of mind, probably will be for some time. We all know the stories and headlines from the past several months. Clinical optimization, certainly that is another topic. And patient engagement continues to be a top 3 priority. I think we're still trying to figure it out. I think there's wonderful examples of things that are working, but you still see areas of focus where providers and even payers are telling us, hey, this is where we're going to go. Cybersecurity, optimization, patient engagement, still discussion on rev cycle and analytics. So on a broad level, that's some things that are coming up out of both of those reports. You'll also find it interesting that when we ask about spending as a percentage of their allocated budget, it's almost doubled year over year. And let me put an asterisk by that.
Yeah, I was like,
4.8% to 9.7%. Okay, so the devil's in the details there, but that is something of interest. I'm sure your listeners probably are feeling or want to hear about.
Yeah.
And here's a real specific example, Aditya. One of the hats I get to wear that's fun is I'm a researcher. I get to pull in some of this research. Just yesterday, talked to a CNIO at a fairly large health system. And, we tried to understand, hey, what are your priorities? What are you working on? Virtual nursing, ambient listening, and internal care model redesign, meaning they internally were working on some redesign.
Interesting.
Yeah, really interesting.
Like kind of like their kind of operational processes.
Yes, yes. So, that's just a peek behind the KLAS curtain. What I heard less than 24 hours ago.
Oh, I love it. Yeah.
Another thing they brought up is they were considering consolidating two patient education vendors, but
Sure.
ultimately decided, hey, we need to keep both because they offer some different things. So, I'm sure we'll talk a little bit today about consolidation. That's definitely a theme coming up. Moving to a platform.
Totally.
We certainly are hearing that as well.
Yeah. So one of the things that, the Spain work that you guys did, and, I know this has been a big part of your specific research area and focus is that, voice of the patient in that. And I know there's, one of the reports that you guys did, I think in 2022 was the voice of the patient report. And it's been, I think at Luma, it was very impactful to read it because I think you classified a lot of capabilities in terms of what patients want, what vendors provide, what health systems are saying they provide to patients. And some of them were just like this. It was like two ships crossing in the night. And so I'm kind of curious because that report was in 22 and you're saying, I think it's a lot of has evolved in the world, both what you saw at health, this conversation with CIOs and other leaders. Kind of what have you found kind of more recently? Are patients, providers, and IT vendors getting more aligned, further aligned? Like what direction is some of that stuff going?
Yeah, happily, there is some nice alignment that we're seeing. So, certainly around digital front door tools. Patients told us back in that early report, they want scheduling, they want access to check in, they just want ease of use to engage. That's one of the big ironies about patient engagement. Patients are trying to engage.
Yeah,
right?
they want it, right? I mean,
they absolutely
all the time. I think one of the best one-liners I get from CIOs all the time, I'm sure you see here this too, is like, we want healthcare to be like the Domino's pizza tracker, right? Because that's what patients expect. And the joke is like deciding between like mushrooms and pepperoni is easy enough, but how will a patient know between a 2T and a 3T, 4-view MR, right? Like it's just the complexity, but the patients don't care, right? Like they want that, they want to engage.
Yeah. And there are things that we absolutely want to remain complex. And you gave a good example. A complex diagnosis, that should be a thorough process, right?
Correct.
And treatment options, et cetera. But really to communicate that I'm going to miss my appointment, I need to reschedule. Basic stuff. I want the Domino's pizza experience for that kind of stuff. And so we're seeing some alignment there. There's wonderful progress on things like self-scheduling. Because that's, like I said, it's a high priority for patients. We hear it often with providers. There's good options there. Some other things that we've seen, now that we have more data through this patient voice collaborative, we've gone from making this a report to an actual collaborative here at KLAS, and we're interviewing patients. It's a survey. We can compare and benchmark and help individual health systems and then compare with other health systems. But now we've got data to start challenging some of these assumptions.
Let me ask a question there. Who holds the assumptions? Like whose assumptions do we need to kind of be pushing against and to make progress?
The politically correct answer is everybody has assumptions, but I'll use providers as an example and not say it's all them, right?
No, I mean, as owning a seat on the vendor side, we have assumptions too. So
yes, we all do.
I'm curious to get your take. Yeah.
But maybe a general assumption is older patients won't use technology.
Yeah.
And we have data to show that's incorrect.
Yeah.
There are exceptions to that. But when we look at this patient voice collaborative data by age, some of the highest satisfied patients are older.
Yeah, I believe it.
And here's another one. Lower income patients won't use technology, or they can't use technology. They too are rating things a lot higher compared to patients that have a higher income. And when we dove into the comments, we were seeing things like, hey, this makes a huge impact because I don't have to take time off work to go to the doctor. And I can, using languages as an example, if communication's happening in my language, that makes my care easier. These are basic things that we all agree, hey, that would make it easier. Here's one more. Sometimes we say, well, not everybody has access to the technology. And of course, there's examples of that.
Of course, yeah, totally.
But, a few months ago at DTI, I was at a conference in Denver, and I was out, I think it was walking to dinner or something. There was a homeless man using his smartphone. And I'm like, that blew my mind that a doctor can reach that person.
Yes, they're completely disconnected from the self-service tools, which is incredible, right?
Yeah. So I guess that's part of the progress. As we get more into the patient voice data, we can start to see, hey, there's really evidence that we have to challenge assumptions. And what I hope your listeners will do is the next time they're in a meeting and someone says, our patients won't behave that way, they won't do that thing, I hope a yellow light goes up and they go, how do we know that?
Yes.
How do we really know that that's accurate?
Are we bringing our preconceived notions of how healthcare operates into this dialogue, or are we actually looking, from a fresh page, understanding the true voice of the patient? So
yeah, absolutely.
There's pieces here which I think you're kind of highlighting, but one of the questions I wanted to ask you is like, highlight, if you remember from being a kid, highlights like the magazine, highlights and lowlights, right? Like there's been some, you kind of highlighted some kind of real positive momentum happening, like there's, more patient self-service, more patient scheduling, any like stay in the realm of things that have gone well in the last couple of years as health ITs continue to evolve. What else is in there? Like, AI's clearly played a part in this. Rev cycle's gotten a little more, maybe it's gotten easier, maybe it's gotten harder. Like, curious to get your take on, what are some highlights? And then we'll transition and say like, hey, what has not gotten better in some of those lowlights as well?
Good. Wonderful flashback to the highlights match.
Yeah, exactly.
Okay, so some things that when we ask patients, what is meeting your needs? And they said, hey, here's what's meeting our needs extremely well or very well. And I'm going to give you two perspectives.
Yeah.
So women highlighted patient payments are meeting their needs extremely well and very well. It's one of the highest replies. Communication before a visit, as well as reviewing medical results. Okay. Now compare that. Men highlighted paying their bill is meeting their needs extremely well. Wayfinding, which was interesting, showed up for men but not women. At least that's how it might be in my house too. I would depend on that tool more. And communication between visits. So
interesting.
Yeah, there's and I don't think that,
and that's like men and women talking about just general their experience in healthcare.
Yes,
like OBGYN or anything. Just the general.
It's very general.
Interesting.
And that's exactly the point I was going to make. Is I hope people will just realize you have to ask the patient. You have to pay attention. You have to understand their perspective. Because some of those things I might have guessed the opposite. Like paying a bill, that was one of the highest things. I would not have guessed that.
I would have never guessed that, including my own personal experiences in healthcare. I just do not think I would love to pay for my doc visit. I just don't think sometimes it's as easy as I think it should be, right? Like my utilities for my power and water is pretty straightforward, but sometimes like that $20 copay is hard to actually figure out how to get it paid.
Yeah. But we're starting to see those examples. Here's a text. You click here and you can pay. Done. I mean, we're getting there. We're not there yet, but I hope it continues to improve that way.
All right, so let's maybe flip the table. So you gave us the creme de la creme. What's the poopy parts underneath?
So number one is price transparency. Patients want that. It's just great, and we know why it's so complicated.
Right? Yeah.
Different,
but that's a problem of our creation, right? Why do patients need a burden with that?
Yes. So, but just that level of frustration, and so even as I say, paying a bill is easy for some, but how much am I supposed to pay? How do I know that ahead of time? So that's one. Finding a clinician, and this is probably some alignment issues. Obviously, a provider, a health system is motivated to get you to choose their providers.
Yep, totally.
That will always
their business models. Yeah.
Yes. But patients want more clarity. Help me find what I need. And certainly we could have a discussion about just availability of that. That's a whole nother issue.
So yeah, let's maybe break that down because that's a really, I mean, I think price transparency, all of us as healthcare consumers can intuitively understand why that's kind of at the bottom of in the bottom of the pile, right? Finding care, finding clinicians, really interesting because I'll be curious to see, like, that's what the patients are saying. Tell me a little bit more because you talk to CIOs, health system leaders all the time. Do they see that as a problem too?
Absolutely. Yeah, it comes up a lot. And one of the well, not a specific technology, but one of the approaches I would say is as tools can be used to reduce the administrative burden on some of these basic things. Hey, I just need to reschedule. You know,
a standard sick visit or whatever it is.
Easy stuff that ought to free up more resources for more complicated things. But they know it's an issue. We've all seen the numbers of how many clinicians are exiting in the next several years. So I think technology still will play a major role in that.
Yeah, and I think one of the interesting parts in like the voice of the patient really is, it's very because, you work on a very daily basis with health system leaders, right? And the vantage point that they provide is very much aligned to their organization. Like, how do I ensure my providers are at the top of their license? I'm providing next 3-day care to like patients who need to come in, prioritizing as medically relevant the new patients so that I can like potentially have the right revenue mix and all this sort of stuff. Like that's really important. But we don't often talk about from the other side, which is a patient in most metros having more than one choice of providers in order to go to. And how do you make that decision? How does the clinic get in front of that patient at the right time if they want to actually, when they're in a shopping mode, quite honestly, when they're in a buying mode, and how do we make sure they route to the place where they can get seen with high quality and at the right time for their convenience?
Yeah. So there's multiple pieces there. One is, there are availability issues, and if I'm being told, hey, we're as good as eating at Emerald Agassi's restaurant, that's great. But if he's not available, I'm still I'm still hungry. Got to go somewhere. I'm still hungry. So there's more and more choices. Consumerism is absolutely alive and well. Think about Amazon. Think about there's more choices there. And yes,
I'm personally actually a One Medical patient, right?
Yeah.
And so like the consumerized storefront, like next to the grocery store kind of like approach of, in a box retail kind of environment, like it works, especially, it's not a ton of chronic conditions where I need to be in like hospital style care. The regular sick visits I need, like it's perfectly serviceable and actually good.
Absolutely. And I'll use behavioral health as an example. Boy, really, really sobering when someone needs help today and they say, yeah, we can help you in 6 months. And
that's for someone in a very dire situation, that doesn't work, period.
It doesn't work. And the answer, unfortunately, is just go to the ER. And it just exacerbates the problem. But there's online resources now. There's tools we can use. And I think that will continue. There's probably a discussion to be had about synergies between retail and existing providers, but I'm not the expert in that by any means. So but there are options. I think not only the availability, but if we can free up some of the resources and use technology to solve some of this, I'm confident it's going to improve. So one other quick example. I met a guy from Phoenix Children's that realized they were losing 2/3 of their own patients due to schedule unavailability. Patients trying to schedule, trying to engage.
Who are existing patients.
And they realized the number one barrier was just clinician willingness to open up their schedule.
Yeah.
And these are patients they know, they have records,
existing relationships with.
Yes. So, for them to say, well, maybe the patient would schedule the wrong appointment. It's like, well, you're telling them to schedule the appointment. We can bridge that gap a little bit. So they took that data to the doctors, opened up more schedules, opened up more opportunities for patients. Scheduling went through the roof. Patient satisfaction went through the roof. No-show rates dropped. Revenue increased. It just, there's a lot of synergy when we pause and really address what the patient needs.
Well, I think that really goes back to what we were saying a little while ago, which is healthcare is not a zero-sum game, right?
Yeah.
Providers got to see more patients. That's what they're in the business of. The healthcare revenues went up. The system revenues went up, right? And then the patients were more satisfied, right? And we talk about like a perfect, hat trick there. And we don't have to steal Rob Peter to pay Paul to make that work, right? It's not a zero-sum game. So let's maybe transition a little bit as we're kind of talked about some of the highlights, the lowlights, and a great example of someone who took, an access problem, availability problem, and really turned it on its head. One of the things I think I've seen KLAS talking about a lot is kind of the there's more stakeholders in healthcare than we often talk about, right? And I think you guys renamed the patient experience improvement market to the healthcare experience improvement experience management. So can you talk a little bit about what is the shift in thinking around expanding the vantage point of the stakeholders in healthcare?
Well, we started hearing about that concept, and rather than just say, well, we're just going to change how we do things, we went and asked healthcare providers, and there was some nice alignment there to go from patient experience to healthcare experience management. And so, if you think about any major healthcare journey you've ever been on, I'll use my wife as an example. 2012, diagnosed with stage 1 breast cancer. And our life completely shifted in a matter of seconds.
I can only imagine. Yeah.
She's doing great. We had wonderful care, but it took a village. It took a village to meet our needs. We had, family helping. We had neighbors and church helping, best friends coming to chemo, and that's just one example. And as I think of other major health journeys, it takes so many to help. And you think about the patient, well, they're also a consumer. They're also a member within a plan, but also the care team. They have needs. I tease Britt Barrett. He wrote a book called Patients Come Second, and I tease him about that.
The inverse of the patient will see you now by, I'll forget his name, but.
Yeah, I know exactly what you're talking about. Great book. But his point is, you have to take care of the staff as well. You have to. And it's a great point. I still love to tease him about it. So, as an example of multi-stakeholders impacting healthcare, KLAS has a collaborative called the K2 Collaborative, or Payer Provider Collaborative. And this is not, a pay-per-view Friday night fight of whose fault is it that healthcare is so hard. It's highlighting points of light. Where is it working? Where are there synergies? So that concept of let's take care of the clinical staff. Let's take care of the family, the patient. Let's ensure that we're measuring the experience of all of them. And that kind of led us to expand our view of that category. And I think it's a symbol of how healthcare needs to expand and will continue to change.
Yeah, I mean, I think so much of what we hear at Luma is around, can you help guide us towards the best practice in some of these things? And a lot of it comes down to how do you make the operational, the non-clinical staff's jobs better, right? So that they can scale up, do better work. Very early on, I'll tell a quick story here before we talk a little more about 2025. I heard this one line. I was at a clinic in Hialeah, Florida, and the clinic administrator told me the worst day for all of us is when a patient comes in at 9 a.m, doesn't know how much they owe, or told they owe a big balance, and starts screaming in the waiting room. And completely understand it from the patient's perspective, completely understand it why it's a tough job from the front office staff, and completely understand why it demoralizes your staff for the entire day. It's if those are the jobs we can make better, as well as, not just the clinicians, but the patients, again, going back to the central theme of, I guess, today's conversation is we can help all boats rise, right?
Yeah.
It does take a village to deliver great care. It takes a village to get a patient from needing care to wanting care, right?
Yeah.
The sheer number of individuals are involved in just getting the patients from scheduling online, hopefully, to arriving in the exam room.
Yeah. That's a great example. And, our provider friends, they do have a hard job. I think they know, oh, this is silly that we can't tell you how much it is. And they understand. And so I hope they know they're appreciated. I hope they know that, there's partners out there that really are trying to solve for these things. KLAS wants to help. It's very, very complicated, but at the same time, there's steps we can take to simplify.
I'm reminded of this line from a TV show, which is like, it doesn't have to be easy because healthcare isn't like it's challenging, but it should be easier, right? So
like
on that, let's look ahead to 2025 to close out this to this episode of Digital Health on Air. What are the things that you're seeing? What is your predictions on what can make healthcare a little easier in 2025?
I think there's going to be more AI examples, and patients, I believe, are going to be eager to use some of these things. Going back to your Domino's Pizza example, Amazon, Siri, Spotify created an AI DJ for me and says, "Hey, Adam, here's your songs for the day."
I love it, by the way, just as a quick aside. I think it's perfect.
We should exchange playlists. I want to see what you're listening to. So, but boy, think about the airport and how you are scanned visually, regardless of which provider you're going to.
Fair enough. Yes. United and Delta. Yeah.
They know who I am. They know my info. There's things that can happen to improve some of that. So I expect that, I think patients are still going to be a little suspicious on some things, but in other ways, we're already using AI in so many parts of our life. Some other predictions broadly, I mentioned that investment is up, so I'm very curious where the energy will continue to grow.
And where those dollars flow, right?
Yes. We've already talked about a greater move to platforms. I think we're going to see more of that. There's lots of talk about consolidation of solutions.
Yep.
A few months ago, I sat next to an executive from a large health system. I won't drop the name, but they were new to their role and they realized they had 47 different tools to help a patient in the digital front door. And they said, we have to get our arms around that. I think some of that's from COVID. You had to grab.
Sure. Every team, every department, service line was just fighting to survive. It makes sense.
That's right. And then I've kind of mentioned already, I'll reiterate though, I expect to see more tools that will help both the provider and the patient, meaning if you can automate some things as the technology gets better and better, that ought to help with these workforce shortages. Yep. And it ought to improve the experience for patients. I'm already talking to bots and virtual agents and a lot of things. So if I can get what I need quickly, and if the communication can be adapted in a way that meets my needs, I think it will continue to improve. I'm not going to pick up a call from my doctor right now. I'm talking to you, but in 10 minutes, I can probably text him back.
Yes.
There's ways we can simplify some of this. So I always joke that our bold prediction is healthcare will be around at least 6 more months. So I have to throw that in, Aditya. How's that for a bold prediction?
I think 6. That is probably not just a bold prediction, but a very accurate one too. I completely believe that healthcare will be here another 6 months, and I may up your ante and take it to another 12.
Okay. Wow. Bold, even more bold. But there's a lot of paths for success. And I want to add to something you said. It's not a zero-sum game. Healthcare is very abundant. There's a lot of people are willing to share ideas.
Yeah.
I see it all the time. I encourage people to network and connect. And, I'm on LinkedIn, Adam Cherrington. If people want to connect with me, I'm so happy to offer any KLAS resources or perspective, but I just appreciate the chance to talk with you, and good things are coming. We have to keep working together.
I love that closing thought, that good things are coming. So Adam, thank you so much. Adam's the VP of Digital Health at KLAS Research. Thank you so much for sharing your insights on what patients are saying and how the market's moving, and sharing with us the golden nugget that we all believe that healthcare will be around for another 6 months. So with that, thanks so much, Adam. Appreciate your time today, and see you all on the next episode of Digital Health on Air.
Thanks.